Welcome to the rotator cuff massage tutorial part 2. If you remember, the rotator cuff is the supraspinatus, infraspinatus, teres minor, and then last but not least the subscapularis. Today we're going to talk about the infraspinatus. This muscle is tucked underneath the deltoids at its attachment site and lies flat on the lower half of the scapula, posterior scapula. But you guys already know all that, and what I do want to talk about is the fact that this muscle is such an important lateral rotator of the shoulder and yet is so thick and lies flat on the scapula. It tends to be overlooked as the source of a lot of shoulder issues and can oftentimes, once it's worked through, resolve a lot of pain and chronic issues that are presenting for your clients. So once I've located the infraspinatus underneath the spine of the scapula, in between the medial and lateral borders, I'm going to methodically work along the fibers going from medial to lateral, but I want to make sure that I really go all the way to the attachment site and visualize where that tendon is attaching onto the head of the humerus underneath the deltoids. The reason why I think this is so important is because there are a couple of key places that the infraspinatus can show up as trigger points and can present as issues or hot spots. But I definitely find that there have been clients throughout my years of practice that different points along this muscle can be really intense and really irritated. So I like to take my time and try to communicate to my client which points are most sensitive and where I feel the most tension. Once I've found a point or two that I feel like is right at the crux of everything for my client, I like to sink in with my elbow, and I like to do this very slowly and stay in communication the whole time. This can be a really tender area and can also trigger some radiating pain that might give you a lot of information. As a side note, my left hand here is helping me to feel any tension that my elbow might not be able to feel, so if they're reacting to anything, and also as a distraction for them if it's a little too intense. When the infraspinatus has a hard time letting go, I like to hold my knee next to their arm and have them notice it. And as I sink in, I have them push their arm up into my knee, so moving their shoulder in lateral rotation, so activating the infraspinatus. As it's activating, I'm pressing down. Once they release and I can sink in a little bit deeper, that muscle is now really letting go beyond what it's normally capable of doing. A nice good stretch is always a good idea after some deeper work, so I'm using my right hand here to pull down and away from their body and using my left hand to stretch all that connective tissue all the way down to their hip. With their arm in this position, I can now work the fibers of the infraspinatus from a little different angle, and I think this is really effective coming from underneath those fibers because this is so thick. This muscle is so thick that oftentimes hitting these fibers from different perspectives can be that one effective tool that makes the difference. With their arm dangling off the top of the table here, I love taking advantage of this position and really opening up the entire shoulder capsule. What I'm essentially doing here is holding the entire shoulder in my hands and then using my thumbs as a pressure point into that attachment site of the infraspinatus and allowing that whole shoulder joint to release and breathe. One last alternative to get into this muscle that I can't say anymore because my tongue is getting tied from saying this muscle's name so much. But anyway, having the client supine, I'm going to pull their arm across their body, and as I let their body kind of be heavy in my hands, I'm going to use my fingers to work deeply along the fiber direction from medial to lateral out to the attachment site of this muscle. It's all well and good to do all this work into the belly of the muscle, but don't forget the attachment sites. All the rotator cuff muscles attach into the head of the humerus, which you already know, but don't forget about them. Sink through the deltoids here, offer a little friction, and relieve their burden of having to hold the shoulder in place as much as they do. That does it for the rotator cuff massage tutorial part 2, infraspinatus. Keep an eye out for parts 3 and parts 4 coming soon. Don't forget to like, don't forget to subscribe, and share with me anything that you guys do that might be different. I'd love to see it. Thanks for watching.